Zinc is an essential mineral that can provide all kinds of healthy benefits if you're able to get enough of it in your system. But how do we achieve and maintain adequate levels? There are two main ways we get zinc into our bodies: diet and supplements. But long-term treatment for deficiency starts with diet. If you're interested in learning about which foods to eat, if you're trying to increase your zinc levels, or if you're interested in learning about how zinc functions in the body, check out the video in the link below. In some cases, supplementation may be necessary, and there are several different types of zinc supplements out there. So let's talk about which type should you be taking and the correct dosage. One important thing I want to point out is that zinc can be taken orally in a few different ways. There are pills and tablets, there are chewables, and there are also lozenges. However, zinc must be swallowed via a pill or tablet to assure that the mineral is dispersed completely throughout the body. If you chew or suck on the tablet, you will not accomplish the concentration necessary for your body to avoid the conditions that can occur with a zinc deficiency. If you have a cold, for example, then you want to take a lozenge, because in that scenario, you are trying to increase the concentration of zinc in and around the nasal passages as well as the throat to decrease the replication of the viruses in those areas. This would be the case if you are trying to ward off a cold. However, if the objective is to make sure your entire body has the proper concentration of zinc, then that's where a pill or tablet comes into play. So how do you know if you are zinc deficient? There are a number of home tests that can help determine your body's zinc concentration. The most accurate result will come from having the plasma of your blood evaluated, not the serum or the whole blood. In this case, you definitely want to mention that to your healthcare provider, so that they can put a note in with the lab order reminding the phlebotomist to use plasma only. What is the proper dosage? If you are not zinc deficient but still want to ensure that you have adequate levels in your body, then the recommended dose is 11 milligrams for men and 8 milligrams for women. Now we get into an area which might be the biggest misconception in supplementing zinc. When you purchase zinc, it typically comes in 10, 15, 30, 45 milligrams, all the way up to 100 milligrams. However, you're not actually absorbing these amounts of zinc. The actual elemental zinc that you get is anywhere from a fourth to a third of the milligram dosage that is on the bottle. If you know you are deficient, then this is especially important to understand. The best way to take zinc is on an empty stomach. However, if this causes stomach upset, then you can try taking it with a little bit of food. Bone broth would be a good choice, or maybe a small amount of juice. If for some reason you still are getting stomach upset, then you can consider taking it with a meal, as long as the meal is low or free of phytates or phytic acid. This is because phytates inhibit the absorption of zinc. Some foods that contain these phytates include seeds, nuts, grains, legumes, and tubers. Your healthcare provider should be able to clearly communicate the lab results. But if you're curious about your results, we are ideally looking for a number roughly between 75 to 150. A normal range is 70 to 250. When one has a result hovering around 70, there is the concern that the individual is borderline deficient. Below 55 would mean that the person is severely deficient, and the best place would be roughly between 100 and 125. But as with anything, you don't want to overdo it. There is such a thing as having too much zinc in your system. This can end up causing a depletion of copper. Zinc and copper use a very similar protein transporter in the body in order to stay active, and zinc has a stronger attraction to this protein. So if you're consuming too much zinc on a daily basis, this can lead to copper deficiency, and we don't want that. So I highly recommend sticking with a lower concentration of this essential mineral if you are taking it daily. around 5 to 15 milligrams daily unless you have a moderate to severe deficiency. There is one other method of getting zinc into our bodies that I want to mention real quick, and that is intranasally. It has been shown in various studies that zinc nasal sprays can destroy the tissue lining of the nasal mucosa. In the 1990s, the FDA warned consumers to stop the use of intranasal zinc products. Many individuals have lost the ability to smell using these nasal sprays. On the other hand, when zinc is administered as a lozenge or via a syrup containing zinc, it has shown great benefit in directly inhibiting the rhinovirus from binding and replicating in the nasal mucosa, mouth, and throat. Also, we have a Cochrane review, which is considered the highest level of evidence that we have regarding the benefits for or against collected data. A Cochrane review pulls together all of the relevant data in a systematic way and determines what the data concludes. What this particular Cochrane review on zinc showed was that if you give zinc lozenges or syrup within 24 hours of onset of symptoms, it reduces the duration of the common cold in otherwise healthy individuals. Also, it found that when supplementing with zinc tablets or pills for at least 5 months, it reduces the chance of catching a cold. I know you're getting tired of hearing me say this, but as usual, you should always talk and work with your healthcare provider before you consider taking any kind of supplement. But this has been a general overview, and hopefully this gives you some useful information about this very important micronutrient. Hit that like button and subscribe to this channel so you can follow along and learn more about staying healthy. Thanks, and we'll see you next week.